Hi, good evening, everybody. Welcome to Channel 6 TV Community Focus. I'm Kenny Fogel, your host. Glad you could be with us tonight. And you know, we always like to do success stories here on our show and talk about people from our local community that has done things that I think you need to know about. And I hope you enjoy the show and learn a little bit as well. And I've got with me a good friend of mine, known him ever since he's a young man, and still a young man to me, and is now Dr. Jonathan Ballard. And Jonathan, first of all, welcome to the show. Appreciate you being here.
Thank you. I'm glad to be here with you, Kenny. It's always a great opportunity and a wonderful experience to come back to Bardstown and be with all my family and friends here.
Now, we're a bit here as we're filming this. It's right after the Thanksgiving holidays, and you did get a chance to come back to visit. And so before we get into what you're doing right now, you graduated what, Nelson County High School?
I graduated class of 2000 from Nelson County High School.
And went on to college to study medicine. So tell me a little bit about that experience.
Yes, sir. So I went to University of Louisville, both for undergrad and medical school. I had a wonderful experience there. It's a public university, but with great opportunities to learn, do research, but also opportunities to go around, see the world, and be immersed in issues not only that was only medicine, but issues that affect the health of the community. And that's what particularly interested me. So I became a doctor, but I've been very interested in public health and those factors that make healthy communities, make our lives to be healthy, and affect people's health more than just one person at a time, but things that impact what we call population health.
Yeah. Well, after you left U of L, you continued to study.
I did. I did a degree in something called epidemiology, which is the study of the spread and control of diseases. I did that overseas at Cambridge University in England, and then I came back and did medical residencies both in family medicine, so I'm a family doctor, and in something called preventive medicine, how to prevent diseases from happening, both of those from Dartmouth College in New Hampshire.
Okay, we'll get back to Dartmouth in just a minute. Now, you did come home for just a brief period of time. I know Governor Bevin hired you for a position in Frankfurt, and explain what that was for a while.
Sure. I had the honor the last 2 years to work as the state epidemiologist in Frankfurt. So this was a position that works at the Kentucky Department for Public Health, and the role is to work to prevent diseases and control the disease outbreaks in Kentucky. There's a large staff, and certainly a great staff of people working in the local health departments all across Kentucky in that field.
I know, say you had your work cut out for you a little bit there. Kentucky is not known as one of the healthiest states in the union. I mean, I'm not saying that as far as illnesses, but is it habit? Is it what is it that we could do better?
Well, contrary to what is the common theme, that health care is not the same thing as health. You know, going to the doctor and getting your checkups are all good things, and getting diseases caught early is a great thing, but only about 15% of what makes us healthy, live a long life, be happy and enjoyable life is actually related to health care. The other 85% of the things in life is what we call the determinants of health, the things that impact our life that determine whether we're a healthy person, whether we're a happy person or not. And those are the things like, do we live in a community that has access to good grocery stores with fresh food, and do we know how to use that fresh food to cook healthy food? Do we have access to exercise? Can we walk freely? Can we get out and exert ourselves to have good heart health? Do we have social networks? Do we have friends that we enjoy being around and can have that relaxation and companionship that makes people healthy and happy? So those are the things that really impact people's lives, I believe, way more than just, actually the doctor's
So more
care.
community to community, more so than on a national scale.
Of course, and in Bardstown we're blessed with such actually wonderful things compared to many communities across the state. In Bardstown you have some wonderful parks, there are some good sidewalks, there are grocery stores here available, and there's wonderful programs that teach healthy cooking. If you didn't have that, you also have access here to vocational school and getting job training and different things that can allow you to have a means to have a good income and access to good employers to be able to achieve good health.
Okay, well, switching gears just a little bit, when I think about a illness outbreak, what Ebola, things like that comes to mind. But I guess what really comes to mind locally is we don't have that kind of issue as much. I mean, we've got hepatitis. I know we do have that. We have things of that nature. But a lot of it we bring on ourselves as far as, like I said, the opioid issue.
Sure. The vast majority of the things that affect the health of our community is chronic disease, things that our own health behaviors sort of lead to those diagnoses of those disease. But that's not to say, though, that the world is not interconnected now. I just got on an airplane, traveled 1,000 miles in a couple of hours to come visit my family this Thanksgiving, and at this very moment, there's 1 million people in the air flying around the world.
Yeah.
So what happens in Africa and in West Africa, very well, and has shown in recent years cases of Ebola that did turn up in the United States. So. Same thing with the hepatitis A. This hepatitis A disease, we believe, originated in Asia, made its way to the West Coast, has been slowly traveling eastward. It's a large outbreak here in Kentucky in the Midwest of the acute hepatitis A. So we do live in an interconnected world. Your health and your health behaviors and what you do actually do affect my health.
Yeah.
And that's what we see with the hepatitis A.
Well, I had a lady in here from the health department a few weeks ago, and she kept telling me, says, Kenny, just wash your hands, wash your hands. I know that sounds simple, but it is a big issue. But again, you say, people don't cook at home like they used to. I mean, they're out at restaurants, and I hate to say it, I don't want to scare anybody away, but you're not really 100% sure what you're getting at a restaurant.
That's true. I mean, I think probably the healthiest thing we could do is buy our own fresh fruits and vegetables and cook them ourselves.
Yeah. So now that you're not here in Kentucky anymore, you went back to Dartmouth. You're their professor at Dartmouth now. What are you teaching there?
Well, I'm a professor there, and I'm in family medicine, and I'm teaching students about that. But I'm also teaching about healthcare, how to deliver healthcare, how to organize healthcare. My main role, though, is I'm a chief medical officer for that state, and I'm.
Now that's New Hampshire.
This
right?
is state of New Hampshire.
New Hampshire.
I returned back there before.
In case somebody knew, and I didn't know where Dartmouth was. When
yep,
you told me where
that's
Dartmouth was, I couldn't pick what state it was in.
That's true. No, I love Kentucky, and I had a wonderful experience living here for the last 5 years. But this was an opportunity I couldn't pass up. I also, before I ever left training originally up there, I met who is now my wife, and we have a lot of family in that community, and we have a 2-year-old now, so it was a great opportunity and a good fit for me to go back to there and have this opportunity. That's not to say that I don't love Kentucky.
They got a little bit of snow up there.
We do. It's Thanksgiving time. We've already had a foot of snow there.
Oh my goodness. So what? I mean, I know you're in family medicine. We'll talk about that just a little bit. But the classes, now, if you as a study research, I mean, what are you trying to impart to others? I mean, I know we do it in 10, 15 minutes. We're trying to impart to the world how to eat healthier and how to live healthier.
Well,
I mean, you're spending
the number one thing is actually telling. This is something that I try to teach the students, the medical students, and the residents. Is telling people what to do doesn't work. So. First of all, forget about that. Telling somebody what to do is not going to necessarily change their behavior.
Yeah.
And so what you try to do in family medicine is ask questions. You ask questions like, to set up dichotomies. Say, I understand that this is something that you value. Tell me about that. Why is it that you value that activity, that behavior?
Yeah.
And and so you can kind of set up situations. We call this something, it's called motivational interviewing. And so you do interviewing all the time.
Yeah.
I don't know if you try to persuade somebody else's behavior by just asking questions.
Every now and then, sometimes it works.
It might work that way. But what we've learned in the doctor's office, at least, is telling somebody what to do and being that paternalistic doctor doesn't work. So we're trying to change the way that family doctors are behaving and how they act, and it's really fun to me.
Well, matter of fact, I just went to the doctor this morning, my annual checkup, and he, one of the first things they did is give me a survey on my emotions. So, have I considered suicide lately? Or do I smoke? Do I drink? How often do I drink? I mean, I wasn't expecting a survey when I went in, and what they do with that, I don't know. But they've got all that information about me.
Well, that is a huge issue right now. Suicide is one of the fastest growing conditions that's been happening across the country over the last 20 years. And so what they're doing with it, they're not doing anything behind the scenes. They're trying to screen early on, are people having risk factors thinking about suicide? And if you do, then they were going to have a conversation with you potentially. And that's one way we've learned that we can potentially help save lives, is that you often don't know unless you ask. So it's ask the question. And we need to do anything we can to to make suicide and mental health, mental illness, not to have stigma, to make it a common place that we can be safe to talk about, and that we can bring it out in the open. And we know if we bring it more out in the open and talk about it, we can get people the treatment that they need.
Well, I know we talked earlier before we went on the air about the opioid crisis, and one of the things you brought up is there's a lot of money going into people rehab and things of that nature, but the prevention of it, as far as finding risk factors and things of that nature,
True.
People are not paying, they're paying attention to it, but it could be more effective than fixing the problem after we got the problem. Prehab instead of rehab, maybe. I guess
I like that saying. That is true. Prevention is hard. It's hard to value prevention because you're trying to measure something that doesn't end up happening. You know, it is important that we increase the amount of treatment and recovery supports that are available for persons who have substance use disorder. It's a disease. And so the question, though, is what are the things that we can do to prevent addiction in the first place? And we're trying to better understand that pathway. We do have some national big initiatives that are going on. One is that there is a CDC guideline on how to safely prescribe opioids and other controlled medicines to cut down on the amount of opioids that are prescribed that may not have needed to be prescribed. And then there are other things that can catch people, say, if they're doctor shopping. That's the prescription drug monitoring program. But as far as really understanding the pathway of what leads to what and how do we catch say risky behaviors early before it leads into an addiction, that's something that we don't fully understand yet. But we do believe it's mostly best done at the local level. The communities know what are the
Can you see
things.
that risky behavior in others, or is that something you have to see in yourself? Or I know it's probably $1 million question there, but is that something that I could say spot in you that you don't see? That I can see maybe you're drinking a little bit too much, or maybe you're getting high a little bit more than you shouldn't get high at all, obviously, but I can tell that you've got a problem. Or is that something I have to just either face up to myself, and if I can't admit it to myself that I've got a problem, I can't fix it?
Well, one, I think if we can bring it more out into the open and we can have these conversations in our families, with our friends more often, and make it more comfortable, the better. Then I can identify my friends, or my friends can identify me and help me kind of correct what I'm doing potentially and get me into the resources that I may need. Some people say you need 3 things to be healthy, happy, and potentially to avoid bad outcomes like addiction. One, you need something to do. That means having a job skill set, having something that can lead you to a career, or activities that you like to do that are enjoyable for you. You need somebody to do them with, so you're not isolated. And we know that things like social media doesn't actually connect you to the world; it sort of more isolates you from your friends. And then you need something to look forward to. So activities and things that you're looking forward to, whether it's family or friends or something that you're thinking about. And so those are the things that can kind of make you a little bit more resilient and less prone to those activities like addiction and other things that may not be a healthy behavior. So that's how do we actually do that? That's the holy grail. We don't know how to do that in the local community necessarily the best. That would be, I think Bardstown and this community probably would be a place that could tackle that before the rest of the country.
Well, do you think mental health and physical health are interconnected? I mean, obviously,
Absolutely,
I think that for years we've been sort of treating them two different ways.
We did. We even, the insurance benefits were actually separate. They had carve-outs and excluded mental health, and we still see that on different types of life insurance policies. But absolutely, they are interconnected. One leads to the other. There's interplay, and if you can't have, if you don't have good health, then you may have poor mental health.
Yeah.
If you have poor mental health, it'll lead to poor physical health.
So basically, for somebody that's suffering from mental conditions, seeing their family doctor might not be a bad idea.
It's not a bad idea, and that's a great place. Early on, if you're concerned for your own health or a family member, that would be a wonderful first place to go to. And I encourage everybody to actually have a primary care provider, whether it's a nurse practitioner, or a physician assistant, or a family medicine doctor, or internal medicine doctor. I just encourage everybody to have one person that actually can know them, can follow them through their life, and that they can trust and feel open and share their thoughts with.
Well, I certainly appreciate you being here today. Like I said, Nelson County's loss, Kentucky's loss is New Hampshire's gain. So I sincerely mean that, because I think you're onto something that we've probably been needing a long time.
Well, I thank you very much. I hope what I can work on and what I'm currently doing can help help the health and for everybody. And I'm just very privileged to grow up here in Bardstown, and I owe a lot of debt and gratitude to this community.
All right, now go Cards. I'll say that. Well, thank Dr. Jonathan Ballard here with me. Appreciate him stopping in there while he's visiting here from New Hampshire, Dartmouth College, and stopping in to visit family and friends. And hopefully we could help you out a little bit as well. Like I said, Christmas holidays coming up. I know that's a tough time for a lot of people. And again, mental health, physical health, it's all health. And again, we do encourage you to, if you have any problems, to seek help and to know you're not alone. And I know people like Dr. Jonathan Ballard out there trying to reach the world and going around and trying to help one person at a time, one community at a time, and that's what we're trying to do as well. So thank you for being here today, and
thank you, Ken.
Safe trips back, and keep all that snow up there. we could use, I could use to do without that this winter. Stick around, a lot more to come here on Channel 6 TV. We'll be back right after these messages.